Hi there, Tracy from Kazadans Equestrian. Welcome to this week's video. If you're new to my channel, then welcome. Please don't forget to subscribe, like, share, click that notification bell so that you know when I release my next video. This week I'm going on with, last week's video about how can we use external or extrinsic factors to start to narrow down the possibility of where our horse's lameness is coming from. Okay, before I start, just to reiterate, what we're trying to do here is give the vet some really good advice on how your horse moves and where and why to enable them to diagnose your problem better and to enable us as riders to be able to diagnose these smaller lamenesses early. This is not for us to become our own vet, because the whole idea behind this for me is for us normal horse owners and riders to be able to find any potential lameness issues earlier than when it's very acute or very chronic. And this is going to increase the chance of a positive outcome for your horse. So this is information gathering, not diagnoses. I just want to clarify that. But moving on from last week, when we had a look at some of the external factors like hard and soft ground, etc., that you can use to help you, we're going to go through a few more today. The first one I want to look at is gradient or incline decline. We can use that to help nail down as well the particular areas that might be causing problems to the horse. Obviously, the first thing you want to do is have a look at your horse on flat ground. But by taking your horse up a hill, what you're essentially doing is moving their weight from the front of the horse to more towards the back. And so if a horse looks worse going up a hill, you may find that the problem is more likely to be around the hind end and pelvic area. So any kind of hip joint, sacro, or even stifle problems can become more apparent going up a hill than they would be on a flat. Of course, when we're going downhill, the opposite shift of weight occurs and we're putting more weight on the front end of the horse. This can show forelimb and foreleg problems up by if they're a lot better uphill than they are downhill. But downhill, a sacro problem and stifle problems are incredibly exacerbated going downhill as well. So if your horse is okay flat but not great uphill, not great downhill, or even worse downhill, you're possibly looking at either stifle or sacro type issues. The other thing we can use is different gaits. Now, a slow walk is great and a trot is terrific because we can look at diagonal pairs and it's easier for our eyes to ascertain if there's any asymmetry there. In the canter, it's a really good gait to have a look at the horse's back and how the horse's back is moving. If the quality of the canter isn't good, so we're talking instead of the horse balancing itself and moving around, lifting its back in a nice canter, if we get a lot of hollowing, trailing out behind, not enough coming in, this really can indicate, again, stifle or sacro issues. If your horse is changing canter leads when you ride them, and they're changing them obviously not to an aid, but just randomly changing their lead, this can be quite indicative of issues. So if your horse is changing canter leads a bit randomly, get on that because it is caused by problems in the hind end. We're talking stifle, hock pain, anything in the lumbar region. Also some suspensory ligament issues this can show because as the horse hasn't got the leverage it needs if you've got any degradation of that. Fetlock pain and even neurological conditions do appear with the first symptom of changing canter leads in a random and unrequested way. If your horse is reluctant to do canter in one direction and the canter transition, what you may find it is the outside hind leg could be causing them an issue. This is the leg that they need to strike off for that canter from. So if they're reluctant to strike with that one leg that puts quite a lot of weight on that one leg for a short amount of time. If they don't want to do that, they're going to have trouble picking up the inside canter lead. So if they're having trouble one way more than the other, it's worth having a look at the diagonal hind to your leading leg. Transitions are also a really good way to have a look and try to start identifying where the lameness is coming from. If your horse is getting a little bit cranky going from trot to canter during that transition, that can often mean stifle issues or also pain in the mid-back. And when we're trying to narrow down problems with the stifle, something that can become very obvious is when you're going in a downward transition from a canter back to a trot, a horse that's having in particular a stifled lock problem, you will find it looks like they almost fall into a bit of a hole as they come down from canter to trot and recover a few steps over. Now, this is quite indicative of a stifle locking or an upward patella fixation problem. Personally, when I look at clients' horses, I love looking at the canter transition. It really does tell me quite a lot. But I also like looking at jumping. So the next one is jumping. However, another caveat in this, if your horse isn't a trained jumper, you're going to get some of these indications anyway, which may well be negative because your horse is just working out how to jump. So make sure you're dealing here with a horse that's trained to jump correctly. So if your horse takes off okay and then in the air kind of deviates, so it doesn't land straight, takes off fine, little deviation of the front end, or tries to land heavier one side than the other, you could well be looking at issues with those forelimbs and the lower leg joints. This can also indicate a pain in the wither region, and if you feel like, if you can imagine yourself as that horse lands front, why the wither could become a little bit of a tricky problem for the horse. So this can also be the problem if your horse is landing heavily one side or deviating in the air. And a little hint, if you're getting a video of this, ideally you get somebody to do a slow-mo video, but if you are, the horse will actually land on the affected forelimb. If it's a forelimb problem, the reason they land on that is the opposing one takes most of the weight. So there's a land, hit, and forward, and this other forelimb or the opposing forelimb is the one that really takes a lot of weight. So if you're trying to work out which forelimb and your horse always tries to land with one, it's the one they first land with that is likely to be causing them the issue. Horses that are taking off crooked are very different to the ones that are deviating after a straight takeoff. If they're taking off crooked, this is normally an indication of a weight-bearing problem in the hind end. And if you have a horse with stifle problems, which are biomechanical problems as opposed to, inflammation or weight-bearing, they often just constantly drop rails, or these are often the horses that simply refuse to jump. Okay, another way, another little test, backing your horse up. If they always want to go to one direction, that can often indicate pain in the back of the direction that they're trying to go. Now, when you do this, please, if you're standing on one side of the horse, get on the other side. And so you're making sure that if they're heading in one direction, it is actually that direction, not that you're directing them with their head or that they're just tending to move away from the side you're on. So you need to make sure you can back them straight normally, and then if you back them up and they tend towards one side rather than the other consistently, this could show back pain on that side. So the next thing we can use is the speed of the horse. Some lamenesses actually look less the faster the horse is going. So a slow trot is ideal to have a look at because the fast trot can sometimes make the lameness appear less. And of course, the same as the gait transitions, just acceleration and deceleration will exacerbate some particular issues in lameness. So when you are decelerating, your horse shifts the weight to the front. So this is going to exacerbate a forelimb lameness. And the other side, when we're decelerating, we're actually shifting more of the weight to behind. So what this can exacerbate is lower back, upper hind limbs, pelvis issues that occur as the weight is shifted to the back end region of the horse. Okay, so there's a lot of different restraints we can use on the horse, and I'm going to call the rider a restraint as well, because anything that's not their free movement is a little artificial and we're imposing some kind of restraint. But this can be helpful when diagnosing some types of lamenesses. What we're looking at here is to try all these tests out and try and work out, although each one individually is indicative of a handful of things, if we're ticking the same boxes and a particular area like the stifle is in every one of those boxes, then, we're going to be heading towards that being the problem. Not indicative as a unit, so one particular test is not going to give you anything definitive yes or no, but it does gather information and provide evidence towards the particular reason your horse may be lame. So when we're lunging or circling a horse, I love to be able to free lunge, because this gives the horse the most freedom for it to show us where the problems are. And when we're looking on a circle and lunging a horse, we really want to be looking at movement in the back. If you are having to use a lunge rein, make sure that there's enough relaxation in the lunge rein for the horse to be able to move its head, because this is sometimes the way they compensate for lameness. So if you're holding your head still, you're not going to see it. So if you have a horse with a sore back on the lunge, you will find that they tend towards moving their back towards the center of the circle. This is stopping them bending quite so much. So this can show you that it's worth having a look at the back. Some horses who are having some problems, you put them on the lunge and they're forever just stretching their neck and doing a whole lot of extension down the spine. And this is sometimes indicative of the horse having problems in their lumbar back region, which can be really referred, so that's a bit tricky, or any other thing in the hind end, but generally along the spine, because as you can imagine, stretching that neck out long and low just provides some relief. This may even be starting to show something like a kissing spine. If they want to put their head down, they just want to open up the spaces in those vertebrae. Okay, now we're going to move to observation under saddle. Now there's a lot of these, but I'm only just going to throw a few at you. I might do a few more later on, but just the simple ones. The minute you are under saddle, you are now adding weight to the horse, clearly. Now, the other thing that you normally do is pick up the reins, so we want to swap those. So when you first sit on the horse, the ideal is to ride the horse then with a loose rein, because with a loose rein, you're not adding any head or neck restraint or any mouth, TMJ problems, etc. And then you can ride your horse on a very loose rein and still enable the horse a freedom of movement as much as possible, and see how that works with the rider on their back. If your horse is showing issues with the rider's weight and no contact in front, then you're normally looking at something along the axial skeleton, so the midline spine area. And this is sometimes a good way to see if you're dealing with a weight-bearing or a non-weight-bearing lameness. A loose rein, no restriction, all you've added is a rider, so essentially all you've added is weight. If a horse is more cranky or the lameness is more apparent in this circumstance, you're likely to be dealing with a weight-bearing lameness, as opposed to a biomechanical lameness. Now, non-weight-bearing lameness, remember, is normally like an obstruction of movement as opposed to pain mediated. So this will probably not show much difference whether there's a rider or no rider. Also, just bear in mind that the other reason a horse can be more cantankerous with a rider weight on their back, sometimes ulcer horses do this, and also mares that are cycling often do this as well. So just bear that in mind. Okay, this video is way long enough. This lameness topic is huge. But I hope this has been helpful. Remember, we're trying to narrow down and provide as much information for a vet as we can for a proper diagnosis. If you like this video, please share around. Don't forget to subscribe, like the video, any comments, questions on the YouTube video below. All of this interaction really helps me keep this channel alive. So thank you again. Subscribe, like, share. Click that notification bell so that you get notified every time I release a video, and I'll speak to you all next week.